This video will explain a typical familial hypercholesterolemia patient's journey and help you understand how it can affect you and your family, treatment options, and how liposorber apheresis therapy may help patients when diet and other drug therapies have failed. An estimated 1 in 250 Americans have FH. However, 90% of Americans with FH may not have been accurately diagnosed. Untreated FH patients have 20 times the risk of developing coronary artery disease compared to the general population. In addition, elevated Lp(a) levels are present in 30 to 50% of patients with FH. Lp(a) is an LDL-like particle that has an additional protein attached to it. Elevated levels of Lp(a) can also increase the risk for both heart attack and stroke and are largely inherited, similar to FH. Nearly 1 in 5 individuals are affected by elevated Lp(a). In the US, it is important to manage your bad cholesterol, such as LDL-C and Lp(a), to prevent future events. Now, let's explore a typical FH patient's journey. Number 1. A patient has a family health history of LDL cholesterol levels higher than 190 milligrams per deciliter in adults or higher than 160 milligrams per deciliter in children. A father, brother, son, or other male family member with heart disease or has had a heart attack before age 50, or a mother, sister, daughter, or other female family member with heart disease or has had a heart attack before age 60. Number 2. The patient goes to their physician, who will likely check their cardiovascular risk factors, including cholesterol levels and current medical therapies and lifestyle, with the goal of improving the patient's health status. Number 3. Since high LDL-C and Lp(a) are genetic and could be passed down, it is important for the patient to have all their close relatives tested, especially their children. Number 4. The physician recommends that the patient implement lipid-lowering strategies, such as drug therapy, diet, and lifestyle changes. Number 5. In cases where the patient has coronary artery disease or peripheral artery disease and their LDL-C and/or Lp(a) does not meet treatment goals per professional guidelines while the patient is on maximally tolerated drug therapies, the physician may determine that lipoprotein apheresis is an appropriate treatment option and connects the patient with the nearest center. Number 6. The patient will meet with the lipoprotein apheresis team to see what they need to do before the first treatment, such as a switch or add a medication, vascular access discussion, etc. Number 7. The patient starts liposorber treatment and should expect to be there for 2 to 4 hours per session. The physician will check patients' cholesterol each session to ensure the levels are lowering and meeting treatment goals. Studies show that meeting LDL-C and Lp(a) targets help reduce the risk of future heart attacks and strokes. Number 8. The patient should expect to have treatments 2 to 4 times per month, depending on cholesterol levels. Since liposorber is a lifelong therapy, it is important that the patient follow their doctor's recommendation. Liposorber provides hope when drug therapy fails.